Wikidonist.com. Truth about tooth.
Last time we spoke about how to choose a brush. Today we will speak about how to choose the paste. Because see, brush and paste is something which is used to clean the mouth, but we have a lot of toothpaste which are available, especially in India. We have Ayurvedic toothpaste, we have other toothpaste which are actually toothpaste, there are gels, there are powders, there are people who tell that you should not use any of these and things like that. So how to choose the right toothpaste, and do toothpaste do what they tell to do. So today I am Dr. Thomas Nechupadam from Nechupadam Dental. I'd like to speak about toothpaste today. So please watch and subscribe my channel, and then press the small ringing bell there so that you can get personalized messages from my channel. So thank you for watching. Toothpaste are something which we always pick up from the supermarket or from the chemist shop or something like that, but how to choose the right toothpaste? Is it the color, is it the texture, is it the taste? That should determine the toothpaste, or is it something else? See, we at India always recommend a fluoridated toothpaste because we don't have fluoridation of the water, drinking water in India, especially we don't have school fluoridation system. So those people who doesn't have fluoridation systems in schools, please take a fluoridated toothpaste. Why a fluoridated toothpaste? Because fluorides will react with the calcium on the surface of the enamel and make it into a calcium fluoride, which is much more less penetrable for all the acids and all these Coca-Cola or Pepsi or whatever drinks you are having, or even any acidic drink, even for fruit juices, it is like that. Even a bacteria will attack the tooth, like for a caries to start, it is actually acidic pH which is being used for taking the enamel off or taking the calcium off the enamel by the bacteria. So it is much more wiser to use a fluoridated toothpaste if at all your drinking water has a deficiency of fluoride and if there is a caries problem. So first thing is fluoridated toothpaste. Whether a paste or a gel, I prefer a paste because gels have silica as their grains, or the aberration comes from silica. So the grain size is much more in silica than the paste, because paste use something called as chalk, or it is much more softer because it's a calcium compound. It expands with water and it is very colloidal in size. So the colloidal size particle is actually something like dust in the air. It's very minute and it doesn't cause much damage to the tooth because it becomes soft or amorphous as soon as it is reacting with water. So it is much more safer to use as less abrasive stuff to brush your teeth. So why there are powders and other like Ayurvedic preparations which are having higher this thing? They claim that it can reduce your staining, it can actually take off your staining. It is actually taking off stains by abrading off your enamel to some extent. So I don't want you to lose your enamel, because I want you to have the enamel for quite some time, because in the olden ages we used to use even sand, and we used to use much other things like even sand and mud and even some of these plant leaves and some wood trunks and things like that to keep the teeth clean. But that's not the case now, because we are in a social media time. Every person is on social media, or even in media. Everybody wants to have a social life, although Corona has taken with a social distancing, but we are now in a social area. Man is a social animal. We want to have good teeth. We want to show our teeth and smile. So we want to have good teeth so that our health is maintained, our social status is maintained. So we don't want to use something like mud and sand to take off the enamel, because once the enamel goes, you will have sensitivity. It is less. It is more susceptible to caries and things like that. It is less resistant to caries. So all these things will cause your tooth to get damaged and the gums to go off. So what else can be, what else has to be taken care? Because there are a lot of sensitive toothpaste. People ask, can I use this sensitive toothpaste, that sensitive toothpaste? None of the sensitive toothpaste is meant for long-term use, because these are sensitive toothpaste, and sensitivity is actually a protective mechanism of the body. It is telling you that there is some issue with the tooth. That is why there is sensitivity. If you lose the sensitivity, what happens is you will not know whether the tooth is getting affected or not, so infected or not. So please make sure that you are not using sensitive toothpaste on a prolonged period. Unless you have a little bit of sensitivity here and there, you can use it for some time, which is prescribed by the doctor. Please go to the doctor and just ask them whether there is a requirement of sensitive toothpaste or is it something else, because I want you to be saved from a root canal treatment or fracture of the tooth due to caries. If you use a sensitive toothpaste, it actually desensitizes the tooth, and then what happens is the caries can progress, and then you can get a pain and things, and then you'll in turn lose the tooth if at all you are too careless about it. So please don't use sensitive. It is just, I always tell that it is like using a paracetamol every day morning, so that you will not have aches and pains. But if you are going to avoid aches and pains by having paracetamol, then what happens is if at all some bad things are there, you might miss it, and then you get into much more trouble by taking this type of drugs. So please understand that there are drug based stuff, like there are some Ayurvedic preparations which will reduce your gum bleeding and actually reduce your it is actually good in some treatment time, but after that you should not continue using on, because these medications will actually mask and tell that there is no issues, but the issues will continue, and then you will lose the tooth. So all these special concoctions and things like that, which are antibiotic in nature, should not be used over time. Even though it is prescribed by a dentist, it is only for a limited period of time. So please make sure that you go to the dentist regularly and check it out whether there are some issues even under or above those things. So please make sure that you select the right toothpaste. If at all possible, please go and check out whether there is fluoride in it, so that would reduce your issues with your caries and losing of tooth, because that is one of the major reasons for losing of tooth. So this is what I believe, because that is, and most of the people who actually are against the fluoride is telling because they are taking instances wherein the fluoride is ingested in the mouth and then taken to the bone and things like that, which can cause brittleness of bone and things like that, but it is in large quantities. It is being ingested, where it is being eaten by people, then only you will get into all those troubles. So please don't worry of using fluoride to be used for cleaning stuff. It is like using alcohol to clean your wounds. You should not drink the alcohol. Actually, you can use it for cleaning the wounds. So something like that. So please make sure that you do that on a regular basis, because so that you will have better teeth, better caries-free teeth, so that you will have better smiles, better social social commitments and social. There will not be any social distancing because you don't have teeth and you look ugly. So I want you to have all the teeth until you die, or until you stop eating anything for life. So so thank you very much for watching me. I want you to have good teeth. I want you to have very healthy teeth. So keep subscribing me and ask me, or if at all any doubts is there, I'll be happy to share it on video, or even send you some messages personally. Thank you very much. I am Dr. Thomas Nechupadam from Nechupadam Dental at Marine Drive, Kochi. Thank you very much.
Wikidonus.com